So today I'm going to tell you about the liver. This is the anatomical position of the liver. This is the right lobe and this is the left lobe of the liver. The liver has two surfaces, a smooth diaphragmatic surface and a rough visceral surface. The diaphragmatic surface includes the anterior surface, superior surface and partly the posterior surface of the liver, and the visceral surface includes the inferior and the posterior surface. Now if we look at the ligaments of the liver is covered with visceral peritoneum. The visceral peritoneum coming from the diaphragm reaches here on the superior part of the liver and forms the coronary ligament at this area. The coronary ligament has two flaps. The two join on the left side to form the left triangular ligament, and on the right they form the right triangular ligament, and they enclose an area that is called the bare area of the liver, which is devoid of any peritoneum. Now if we see at the anterior surface, this is the area of the falciform ligament of the liver. So falciform ligament is the one which is connecting the liver with anterior abdominal wall. This is the inferior border of the liver. Now coming to the visceral surface, the visceral surface has four lobes. So functionally liver has four lobes, the right lobe, the left lobe and two additional lobes, the caudate lobe and the quadrate lobe. This is fissure for gallbladder, having the gallbladder, and this is fissure for inferior vena cava, having the inferior vena cava. The transverse fissure is called the porta hepatis, having the portal triad that contains the portal vein, hepatic artery and the bile duct. Now the visceral surface has various visceral impressions. This is the gastric area, this is the colic area, this is the suprarenal area and this is the renal area. So these are the various impressions on the visceral surface, hence the name, the visceral surface. And this one is the diaphragmatic surface.